Diabetes. It's a word we hear often, but its implications, especially on our heart health, are often misunderstood. What many people don't realize is that diabetes and heart disease share a silent connection, a dangerous liaison that can have serious consequences if left unchecked. This connection is critical to understand because it's not just about managing sugar levels. It's about safeguarding the very engine of our lives, our heart. When we talk about diabetes, we're essentially referring to the body's inability to properly utilize glucose, our primary energy source. This inefficient energy utilization, often stemming from insulin resistance or lack of insulin production, creates a domino effect, setting the stage for a range of health complications, with heart disease topping the list. Imagine your blood vessels as a network of highways transporting vital nutrients and oxygen throughout your body. Over time, uncontrolled diabetes acts like roadblocks and detours on these highways, hindering the smooth flow of traffic and putting excessive strain on your heart. The link between diabetes and heart disease is multifaceted, but one of the primary culprits is high blood sugar. When blood sugar levels remain persistently elevated, it's like sandpaper constantly rubbing against the delicate lining of your blood vessels, causing tiny tears and inflammation. These injuries create the perfect breeding ground for cholesterol plaques to build up, narrowing and hardening your arteries, a condition known as atherosclerosis. Atherosclerosis is particularly worrisome because it restricts blood flow to your heart, increasing the risk of heart attacks. Imagine your heart, a tireless worker, being deprived of the oxygen-rich blood it needs to function optimally. This deprivation can manifest as chest pain, angina, shortness of breath, and in severe cases, a heart attack. But the damage doesn't stop there. Diabetes also increases the risk of other cardiovascular complications, such as high blood pressure, high cholesterol, and obesity, further compounding the burden on your heart. It's like facing an onslaught from multiple fronts, making it even more crucial to address the root cause diabetes to protect your heart. The good news is that you have more power than you think when it comes to safeguarding your heart health, especially if you have diabetes. While genetics play a role, lifestyle modifications are your most potent weapons in this battle. It's about making conscious choices every day that nourish your body and support your heart. One of the most impactful changes you can make is embracing a balanced whole food diet. Think of your plate as a canvas where you paint a vibrant picture with colorful fruits, vegetables, whole grains, legumes, and lean protein sources. These foods are naturally low in saturated and trans fats, which contribute to heart disease, and rich in fiber, which aids in blood sugar control. Just as important as what you eat is what you don't eat. Limiting processed foods, sugary drinks, and unhealthy fats is crucial. These dietary villains are often laden with added sugars, unhealthy fats, and sodium, which can wreak havoc on your blood sugar levels and heart health. 4. The Power Trio: diet, exercise, and checkups. While diet forms the cornerstone of heart-healthy living with diabetes, regular physical activity acts as the mortar that holds everything together. Engaging in at least 30 minutes of moderate-intensity exercise most days of the week not only helps you maintain a healthy weight, but also improves insulin sensitivity, allowing your body to utilize glucose more effectively. Think of exercise as a prescription for a healthier heart. It doesn't have to be strenuous. Find activities you enjoy, whether it's brisk walking, swimming, cycling, dancing, or gardening. The key is to move your body regularly and consistently. Finally, just as you wouldn't ignore a flashing warning light on your car's dashboard, regular medical checkups are non-negotiable when you have diabetes. These checkups are your opportunity to monitor your blood sugar levels, blood pressure, cholesterol, and other heart health indicators, allowing for timely intervention if needed. 5. Your heart's best friend, you. Living with diabetes does mean you have to be more mindful of your heart health, but it doesn't have to be a life sentence of restrictions and fear. By embracing a holistic approach that includes a healthy diet, regular exercise, stress management, and close collaboration with your healthcare provider, you can take control of your health and reduce your risk of heart disease significantly. Remember, your heart is your most precious asset, and you are its most devoted caretaker. By making heart-healthy choices a way of life, you're not just managing diabetes, You're investing in a future filled with vitality, joy, and a heart that beats strong for years to come.